For the last 2 years, we've been looking at including over 1,000 young people, really exploring what technologies they use, why they use them, and looking at some of the challenges around that, how it shapes their identity, their health behaviours, and really getting a better understanding of what they're doing online. So, in terms of our findings, some of the significant themes that have come through have really been around things like the pervasiveness of body ideals within social media and how that can lead to forms of body disaffection or anxiety. And equally, those spaces can be forms of new knowledge, so learning about health in different ways. Young people are actively using things like tracking devices and wearable technology to monitor their everyday practices, and that includes things like sleeping, diet, menstruation, mental health. So overall, there's a whole range of technologies that young people are accessing for various reasons, to track and monitor what they do, but also to learn about health and to seek help in terms of health support. So one of the interesting findings that we had was that they value both official kind of health organisations in terms of offering what we might call sort of authoritative knowledge around health. So things like the NHS being really important in terms of knowing that it's safe, regulated and valued information, but also the role of perhaps more user-generated material, so young people creating health knowledge themselves on platforms like YouTube, which was one of the most popular platforms in terms of learning about health. And one of the reasons for that was that young people like to feel that they're connected to people who are like them or experiencing similar issues to what they're experiencing in terms of their health. There are also some challenges, so issues around security, data privacy, and navigating through this landscape of knowing what to use and when to use it and how to interpret data. So increasingly we see the role of others playing a really important part in that process to help them to make sense of this vast volume of data that they're collecting about their everyday lives. So as a result of that, we've hosted the event today, which is really about sharing some of that work with some key stakeholders or user groups, but also bringing young people into those conversations and trying to develop some, if you like, joined up thinking across different sectors in terms of having some conversations around those challenges and opportunities. I would say the level of criticality that young people bring to their own experiences of health. So they are already aware of things like photoshopping, filters. So some of the old strategies, I guess, to develop things like media literacy are not enough, I think, in this digital terrain. So they're highly critical of technologies. They use them quite often on a short-term basis. So we know that they bring this sort of level of criticality towards what they're doing. I think the other thing that's been quite surprising, I think, is the way that they reappropriate technology or use them in ways that we perhaps didn't expect them to. So I think that shows potential for creativity and to use technologies in ways that we perhaps didn't expect. Maybe one final thing is around issues of inequality and inclusion. So we assume, I think, that young people, because they're growing up in this digital world, that they're competent, they're what we might call this term that gets used a lot, digital natives. But actually, their ability to make sense of data, knowing what to use and what's safe, varies a great deal. So I think when we think of digital literacy, there's a whole spectrum in terms of inclusion and understanding. So there's a real need to help develop resources around that. I think the project's legacy will be continued conversations across multiple groups that have a role to play around the future design and development of digital health technologies. So there's lots more to do, lots more to understand, but I think we've started that process of mapping out key milestones and raising, I think, some critical agendas for future conversation.